Bus operators are threatening to withhold a service if a solution is not reached soon. They are expressing their dissatisfaction on government's payment offer for services provided from March 25th to date. A group of these bus operators from different zones converged at the ministerial complex Tuesday morning with the hope of reaching some form of settlement. Two by two, they were called in to hold discussions with Permanent Secretary in the Ministry of Health. On their return, it was not good news as the matter remains unresolved. Speaking with the media, bus driver Garth Woodruff says this has created a major setback for them as they all have financial obligations, families to maintain, and the buses to also maintain, and have not been able to do so.
This group of bus operators, we are here because we are unsatisfied with the payment and the way things has been done and the treatment that we have gotten from the government of Grenada through the Ministry of Health. So we have had payment issues, right? To this date, a price was proposed and we do not agree with that price, right? It was not the price that was initially negotiated. So apparently there was some miscommunications and we are trying to address those issues right now to find a way in which we would all be satisfied with the work that we have done.
Woodruff did not wish to disclose the initial amount as the matter is still being negotiated. However, the amount owed almost totals 3 months of service for which they have not received 1 cent. This driver, who opted to speak off camera, said he provides service for 3 locations, dropping and picking of staff at Mount Gay Psychiatric Hospital, the General Hospital, and the Richmond Home. Initial negotiations with the Permanent Secretary in the Ministry of Health and General Hospital officials, according to him, had agreed on a price they are willing to pay. The payment were, in his words, dragged out a bit until threats were made by the drivers to withhold their service. He deemed this as a disservice to them by the authority.
Up until yesterday, I was told that the payments would be available yesterday, right? And the payments that was available for us yesterday compared to the agreed payment that we were supposed to get, it was just about 20% that was issued to us yesterday. I have, along with some other of my colleagues, we have refused the payments until this is rectified.
They are appealing to the government to rectify the initial payment they were supposed to get or negotiate an amount they can be satisfied with by Monday latest.
Cannot speak for everyone, but here I have agreed to work, right? Because there is a bigger picture here where we have to get the nation's nurses and so on to the hospital because there is no public transportation operating. So I think it's fair to still continue for the time being until we know exactly what is going to come out of this.
I am willing to give them some time to come up with an agreement suitable that I could sustain myself and my family. They cannot come to that agreement. I don't have a choice but to withdraw my services.
GBN sought a comment from Permanent Secretary at the Ministry of Health, Charlton Henry, who was seen on the compound, but he told the news team he was busy and couldn't comment at the time. Efforts to reach him via telephone later in the day proved futile. Chrislina John, GBN News.